I will start with our introduction today. We're going to be talking about the oral examination for board certification in clinical health psychology. And this is really designed to help you organize yourself in preparing for the exam. So again, the objectives for today are really to talk about each of the four portions of the clinical health psychology oral exam, better understand what's expected on examination day, look at some of the methods that you might use in preparing for your examination, and learn about virtual adaptations of the exam that you might anticipate. So for us to get started, let's talk about who's on our group today. We want to introduce each of yourself briefly. Julie, we'll start with you.
Hi all, my name is Julie Radico. Happy to be here.
And Lloyd.
Hey, I'm Lloyd Berg. I'm a board certified clinical health psychologist and oral examiner.
There you go. And then Christina Shook is having a little technical problems getting in today, so she might be joining us later. And I'm Mark Vogel. I'm a clinical health psychologist. In terms of a general orientation to the oral exam, so usually those oral exams are scheduled about 3 times a year. The fee is an additional fee to other fees you would have paid for other steps of $450. And then it usually takes place at an assessment center. And there you meet with 4 different examiners for each module of the 4-hour exam. So you would go from station to station as you go through this. And what I would say is, certainly my experience and others has been, that it really is a collegial experience. It really is something that really helps people feel like you're showing what you know, and you're being able to have a great discussion. And it really is a interactive collegial examination. So again, the 4 modules are the ethical and legal issues involved, professional issues, the practice sample, or if you're going through the distinguished senior candidate portfolio, that would be that element, and then a standardized clinical case assessment and integration. So we'll be talking about each of those 4 modules, and we'll be breaking them down a little bit more in detail. And then what you really need to appreciate is that really across all those modules there's this sense of being able to show your competency in a number of areas. So really, integration of science and practice, how you kind of are able to take what's new in science and apply it in your example. How you interact with others in terms of really describing your work that you do, and how your collegial interactions as well. Individual and cultural diversity obviously is critically important, as well as the ethical and legal foundations for what you're doing or have done, your practice examples, etc. And then really how you begin your professional identification as a clinical health psychologist, and how that is really exemplified in all 4 elements of the examination process. So with that introduction, I'm going to pass it on to Dr. Radicchio, Julie, and have her present this next section.
Thank you, Dr. Vogel. There's a quick question in the chat before we start. So will the attendees have access to the slides afterwards?
The answer is we will post the video of this webinar on our website as soon as possible, and a PDF of the slides should also be available at that time.
Wonderful. So welcome all again. This slide just goes over that the oral examination now focuses on new cross-cutting competencies for those applying after December of 2018. And this just gives you a breakdown of the foundational competencies and the functional competencies. So this is all very clear, spelled out when you look at the application materials to start writing and submitting your practice samples, and it explains all of that in detail. So next, I'm going to provide you with a brief overview of what you can expect on exam day. So you've gotten accepted to go for ABAP, you have submitted and passed your practice sample portion, and now you are waiting for your oral exams. And what you can expect on that day has a lot of different components that I think cause people anxiety, and we're here to hopefully reduce some of that anxiety for you. So those that you can expect to interact with on exam day include other examinees, include examiners, so examiners who are very experienced in this, and then also those who are in training, could be shadowing to learn about how they can do the oral examination process. Also, if you're on location, you may interact with location staff. Virtually, you'll interact with the same group of people, but maybe not staff. The exam itself spans 5 hours and is inclusive of breaks. You will have time to use the restroom. You will be assigned either if it's in person, room, or if it's online, a virtual room. So to reduce your anxiety, all of the examiners will come to you. So you get to stay in one spot and they'll come to you. Information for each task will be provided in each section with clear parameters stated. So you're not going to go into a portion of the exam and be like, wait, was I supposed to remember all the things I'm supposed to do now? We'll explain that to you. And then you will not be given feedback on the exam day. This is normal protocol. So, some considerations for the virtual exam. Make sure you choose an environment that limits distractions and where you can be alone for the duration of the exam. You will be asked to show your exam environment with your camera so that the examiner can see what's around you. You will be allowed to bring copies of the materials that you submitted for the written section of the exam, such as your work sample. For the standardized case section, you are allowed to take notes or use a clinical interview outline, but whatever you write down, we request that you shred it after the exam. You will be asked to also provide a phone number on which you can be reached on the day of the exam. This is a backup just in case there are any unforeseen connectivity issues, because we all know that technology is our friend at times and then not our friend. So the big question that you're all sitting there thinking, what are the examiners looking for? The answer to that question, genuinely, is many things, none of which are secret or are meant to trick you. Think out loud. If all of us could give you one piece of advice for an oral exam, it's to think out loud. Tell the examiner what you're thinking. What would be different if you had more or less information? What would you have done differently if you could change X? If you have the knowledge but don't share it, the examiner won't know. Also, sometimes how you would gather information and utilize your resources is more important than having the perfect answer. I want to normalize that you will make mistakes. You're human. The examiners do not expect for you to be perfect during the oral exam. Therefore, be prepared to manage your anxiety. The examiners want to know what you know, not prove what you don't know. Utilize your self-coaching, your self-soothing strategies. So the idea is not what to do if you goof up, it's what to do and be prepared for how you'll respond when you goof up. So identify your mistake, address it, name it in the moment. Show flexibility and critical thinking as information changes. Some general encouragement. Eat, hydrate, dress professionally even during a virtual exam. Be polite to everyone. Set aside plenty of travel time, or if you're doing the exam virtually, give yourself a lot of time to log in advance. Maintain confidentiality. So a big part of confidentiality is that we ask that you don't talk about the components of the oral exam, like the the samples that you're given, the cases that you're given outside of the exam. However, this doesn't mean that you can't connect with other individuals, the other examinees that you're sharing that day with, and support each other. We encourage that. So I am going to hand it over in a moment to Dr. Berg, who is going to give you some tips about preparing for and navigating the ethical portion of the exam. We will also be reviewing the professional issue section, the standardized clinical case section, and the practice sample section. But Dr. Berg, take it away.
Thanks a lot, Julie. Very excited to be talking to all of you. And we're going to talk next about preparing for the oral exam. We're going to be talking about specifically, number one, how to prepare for the ethical issues module of the oral examination. Before we start talking about the specific modules and preparing for each, I just want to remind everyone that it's really, really important for each of you to go to the ABEP website and download the candidate manual for clinical health psychology. I can tell you that the manual has a lot of information and a lot of specific detailed information about how to prepare for the oral examination. So if you go to the abep.org website, you'll want to go to the candidate information section, and on the left-hand side, you're going to see clinical health psychology. You're going to download the latest candidate manual, which is from September 2018. And the preparations for the oral examination start on page 19. So please, if you have not done that already, or if you did that already but you haven't, but you've passed the practice exams and you haven't referenced it since then, please go back and read the candidate manual. So let's talk more specifically about the ethical issues module. So what is going to happen? You're going to be meeting the examiner who's going to introduce you to the ethical issues module. Virtually what's going to happen is they are going to put up on the screen a scenario that is chock full of ethical dilemmas, professional conflicts, and you're going to be given about 10 minutes to review that vignette. And during this portion of the exam, you're allowed to take notes, so you can write down everything that you'd like to. You have about 10 minutes. And then the oral examiner is going to ask you to start discussing ethical dilemmas that you might identify, or professional conflicts or legal concerns throughout the vignette. And in order to, and then you will. During this portion of ethical issues, they might also ask you, as you're talking about the vignette, they might ask you to talk maybe more about a particular issue, or how that might present in the clinical realm where you work. So in order to prepare for ethical issues module, the first thing, it's really important to read through the latest APA ethical principles of psychologists and code of conduct. You want to familiarize yourself with all of the principles, and as you're doing that, you're going to be wanting to think to yourself, how do I comport myself to these ethical principles and code of conduct in the clinical work that I provide? As you're doing that, you're also going to want to be reading through your state licensing board code of ethics and any other code of ethics that you might have at your institution. And again, be thinking about scenarios where you practice in adherence to these guidelines, or be thinking about clinical challenges that you have faced where you've had to be familiar with the ethical guidelines and how you work through a potential ethical dilemma. You might also want to consider reviewing a book of case studies related to clinical health psychology and have someone quiz you. It's really important to also be familiar with the laws in your state pertaining to the practice of psychology. If you work in a federal agency or institution like the VA or the Department of Defense, you also might want to review how state laws and ethical principles are applied in your unique settings. And so that's all just to help prepare yourself. But in the moment, in terms of the actual oral exam, here's some ideas about how to navigate the process. So the first thing to remember is that you're going to have a 50 to 55-minute dedicated portion to talking about ethics and their applications to your clinical health psychology work. But also remember that throughout the 4 exam modules that you're going to go through, you might be asked to reference ethics and ethical principles in other scenarios as well, related to your clinical work in the interdisciplinary teams that you work with. So just know that it's not circumscribed to just this one ethical module. As you're being asked about ethics, also be prepared to discuss ethical issues that you have faced yourself personally in your practice setting, not just those that you are being asked about in the clinical vignette or ones that you have referenced in your professional sample. The examiner may go back to your professional statement example and perhaps ask you to expound a little bit about that issue. Also be prepared to discuss the broader interpersonal ethical scenarios in population health ethics. I'm a consultation liaison psychologist, and so I'll just give you an example. I sit on the heart transplant board, and oftentimes we're asked to face ethical challenges around limited donor pools. And how do we discern who is an ideal candidate? And how do we navigate ethical issues around that selection process? Funded versus unfunded patients, for example. So just be thinking about not only specific clinical examples, but broader implications of those. It's also really important to be thinking about how issues of diversity may come into play in the ethical and or legal situations you're facing. Be prepared to, if you have a clinical scenario with a white female, for example, the examiner might ask how things might be similar or different, or if you were working with a person of color in this scenario, or a different socioeconomic status. Also, it's important to be identifying some of the unique ethical scenarios faced by clinical health psychologists as compared to psychologists working in other fields of specialty. What are some of the things that we deal with all the time that maybe someone specializing in clinical psychology may not be facing? I'm thinking, for example, of how we handle issues of confidentiality within our interdisciplinary work teams. So Julie, if we can go to the next slide. Next, I'd like to talk to you a little bit about how to prepare for the second oral exam module, which is the standardized clinical case assessment and integration. So in this module, you're going to be, the oral examiner is going to provide 2 standardized clinical cases for you to consider, and you're going to choose one of those. And so then virtually what will happen is they will put up a clinical standardized clinical case vignette scenario on the screen. And again, you're going to be allowed to have your own standardized clinical assessment tool in front of you that you utilize. If you don't have one, I encourage you to put one together. You're also going to be allowed to take notes. You're going to be given about 5 minutes or so to review that clinical case scenario. And then what you're going to do is you're going to start asking the examiner for more information. You're going to be asking specific questions about what else do you need to know about a patient's presenting the history of present illness, family history, prior psych history, everything that you're going to be utilizing in your own assessment in order to start formulating a diagnosis, a differential diagnosis, recommendations that you'd be making to the treatment team, and as well as formulating an initial treatment plan. You'll be able to take notes. Again, at the end of this scenario, we're going to be asking that you shred those notes and your assessment tool and respect the confidentiality of the examination. So, in order to prepare for this oral exam module, consider reviewing a health psychology textbook, clinical health psychology textbook that covers major health disorders. You might even want to consider making note cards related to evidence-based assessment, evidence-based intervention considerations for each of the disorders. You know, and also some of you are going to be talking from a primary care background, and so the textbook that you might access might be different from someone who's working in a specialty care clinic or a hospital. But again, the important thing is be thinking about reviewing the literature, familiarizing yourself not only with your area of specialty, but you might be also asked to talk extemporaneously about some other conditions. I suspect that some of our presenters might be willing to give people ideas if there are questions about what might be some go-to textbooks in this regard. You also might want to review some of the other literature. Look at UpToDate. Look for review articles, reviewing the latest guidelines and recommendations for areas in your specialty practice. Quiz yourself on these assessment and intervention practices. What are your go-tos? What are some scenarios where you might consider alternative intervention strategies? Also, check the standardized health psychology assessment template that you utilize and make sure that it's up to date with the latest literature and updated if it's appropriate. These are some ideas about preparing yourself. Let me give you some ideas now about how to navigate in the moment with your oral examiner. Oops, Julie, can we go back just back? Thank you. So remember to have your blank assessment tool with you to help organize your thoughts, organize the way that you're going to go about gathering information. Also, if you don't have the information that you want, please ask the examiner for more information. Your oral examiner is going to have a lot of case information about this patient. So, but the examiner is not going to offer you information unless you ask for that specific information. So again, don't be afraid to reference your template and make sure you review all the areas that are relevant for you to make a solid diagnostic assessment and make recommendations from that. Make sure you time yourself well. You'll probably have anywhere from 20 to 25 minutes to gather all the information. The oral examiner will also have psychological testing information if you would like some of that information. But again, you're going to have to specify what kind of assessment tool you'd be wanting to utilize and what kinds of diagnostic information you'd be gathering from that assessment measure. And it's also, it's really important to understand and remember that it's okay that if you have either of these case presentations that are offered to you, if you haven't treated either of those types of cases, it's really okay. It's okay for you to reference what you know from the literature that you've reviewed in clinical health psychology, and also to note how you might refer and consult with other professionals with expertise in this area. So it's okay to tell them what you know. It's also okay to tell the examiner what you don't know, but who you would access, who you would refer to and consult with, who would have that type of expertise. Next slide, Julie. Next slide is how do you prepare for the professional issues component of the oral examination. This is a fun part. So in this section, you're going to be asked questions about how you identify as a clinical health psychologist. What do you do in your day in and day out practice that differentiates you as a clinical health psychologist as opposed to some other area of related specialization or expertise? How would you, for example, if you were a pediatric psychologist who decided to specialize in clinical health psychology, I might have the question of, tell me why you decided to go clinical health instead of clinical child and adolescent psychology. So again, be thinking, how do you distinguish yourself as a clinical health psychologist? You'll also be asked in this time frame to talk a little bit more about how you practice, how you engage and interact with the professional teams that you work with. What are some of the ways that you keep up with the current literature in clinical health psychology? What journals do you subscribe to? You're going to be asked questions possibly about what professional organizations that you belong to. What are some ways that you demonstrate citizenship in your arena? For example, what kinds of professional committees do you serve on? What types of services do you provide to your community around the topics of clinical health psychology or your specialty in clinical health psychology? Let me talk to you a little bit about preparing for this. So this is a really collegial component of the exam process. It's important for you to familiar yourself with the APA guidelines for psychological practice in healthcare delivery systems. So this is an important document you're going to want to review and be thinking to yourself, how do I comport myself in alignment with these guidelines, and how do I practice in a health delivery system? And also be thinking about examples that illustrate how you comport yourself with the specific areas in the guidelines. It's also important to think about demonstrating how you identify yourself as a clinical health psychologist. Again, how are you involved in professional organizations? What are some of the activities that you engage in to demonstrate professional development? How do you keep up with your competencies in clinical health psychology? Also, how do you engage in your own professional self-assessment? Where are your areas where you find your professional growth edge? For example, all of us have had gone through a quick immersion on how to deliver clinical health psychology services and assessment virtually. So how did you go about, for example, gaining those competencies? How do you integrate existing competencies with these new challenges? So those are some ideas about preparing for this section. And as far as in the moment navigating with your oral examiner during this module, during this portion of the exam, you don't need outside notes or materials. You should not have anything. They're going to be talking to you and asking you about your own professional experience. Having said that, don't hesitate when you're asked a question to reference the personal statement that you've already developed for to go along with your practice samples. It's really good to remind the oral examiner what you've already documented. Just give them a full, don't worry about being redundant. Give that information and be prepared to provide additional examples of your practice. You can expect during the exam to be asked about a controversial issue in the field of clinical health psychology. Let's just say, for example, you're asked by the examiner what your thoughts are about prescription privileges in psychology. What's going to be important is not necessarily where you stand on the controversial issue, but the oral examiner is going to be looking for how you talk about, in a knowledgeable way, the pros and cons of the issue, in order for you to demonstrate an informed understanding of not only your opinion and what informs your opinion, but an appreciation of the other perspectives that make this an area of controversy. And above all, I just want to remind you that this is the opportunity in the oral examination to really highlight your accomplishments. So if you have awards, if you have been recognized for achievements, please don't hesitate to incorporate that in your answers. And on that note, I'm going to turn over the microphone to Dr. Vogel.
Great, Lloyd. That was very informative and helpful. I specifically remember in the standardized case example, getting a case that I knew nothing about. I never even knew that you could even do that. And I said that to the examiner, and I said, here's what I do know, though. So don't be afraid to share what you know. When it comes to the practice sample, again, this is cases you've submitted. And so what you need to remember is that the practice sample really serves as really the jumping point off for a discussion about issues related to your clinical practice in health psychology. So first thing for you is know your case really well. You can bring your case into the exam with you, but know what you've put in there, what you talked about. I mean, you should know if it, because you've spent so much time putting it together, but make sure you remember it, because any of those things that you put down there can come up as part of the questions. And also, as we said before, we're interested in kind of how someone's thinking. So be really clear in your understanding of how you decided, to pick this case, how you decided to kind of your interventions, what was your rationale, and your conclusions about how you got to where you thought you were at the end of the case. And so what the examiner is looking for is how the case and other things help exemplify your professional practice as a clinical health psychologist. And so when you get into the actual exam, be prepared that, again, your questions you get may go beyond that case to examine your general knowledge. So for instance, if you picked a case of which maybe there's a controversy about an intervention or a diagnosis or whatever, be prepared to discuss that. Know what the literature says. Maybe since you presented this intervention, new literature suggested, well, maybe there's some questions about how effective that is. Know your literature, know what people are saying about it, so that you can really come into that discussion well prepared, looking for what's the gaps in knowledge, being able to understand that. And so you're kind of really wanting to demonstrate in this process that you're showing some reason why you're choosing to do what you did. You can draw on the literature to help inform what you're doing. Your approach is defensible. It's not just something, well, I thought that would be a good idea. You really can show why you worked your case this way, or what some other alternatives would be. So again, I think this part of the exam can be a lot of fun, because it really is helping to highlight what you know really well. You know this case well, you felt comfortable enough to submit it, it was accepted. Now let this be a good way to show what you know as a clinical health psychologist. All right, so I'm gonna hand it back off to Julie for this next section.
All right. So, telehealth. COVID has happened. COVID has changed the way that we practice. So we want to invite telehealth practice samples and hope that you would address in such practice samples what makes it easier or more difficult for you to do work in your specialty because you're practicing through telehealth or because you were challenged by the pandemic. What are some of the ethical issues related to this model of care? So using telehealth, telemedicine, and how do you navigate those ethical pitfalls that might be coming up because of doing telehealth in your setting, which could be in a hospital, in a clinic, in private practice. Next slide, please, Mark. Thank you. All right, so upon passing the orals, congratulations, you passed. This can happen for you. We hope this happens for you. What happens is that the chair of the exam committee sends the results to the ABAP central office. and candidates. So you would receive your notice of passing within a month of taking the exam. So again, you're not going to get feedback from the examiners on the day that you take the exam. That's normal. You can start to use the title Board Certified in Clinical Health Psychology and have that in your signature bumper. It's in all of ours. It's a really important thing, especially if you work in a hospital, VA, medical type of setting. To have that board certification can be really, really useful for your colleagues to like recognize and see that. Immediately, you have conferred membership fellow status in the American Academy of Clinical Health Psychology. And we are all board members in that. And so that's why we're here talking to you, because we want to encourage you to pursue this board certification and give you like advice to get you to be able to succeed. You get 20 CEU credits if you pass. So if you get board certified, you can automatically bank for your licensing credentials for that year for whatever state you're in, 20 CEU credits, which is a beautiful thing because we recognize and ABAP recognizes that you put a lot of work in, and so you get credit for that. And then you get recognition at the ABAP convocation at the APA, at our national convention. So you have all been fantastic at utilizing the chat box and the questions button. And we want to have the remainder of our time to have you continue to do that, to have a conversation, space for you to ask us questions. On here, some additional resources, the website, so our Academy's website, there you can find resources to help you throughout this process, but also get a snapshot of some of the people who have recently been boarded in clinical health psychology. And then again, have access to like video tutorials. So we have a YouTube page. This will be posted on that YouTube page for you to have access to watch these videos again as you like get closer to the oral exam, depending on where you are in your process. And then feel free to reach out to any and all of us. Here are some of our emails, and we welcome your questions. Again, we want you to succeed, and we are happy to answer, even if it's something that you're like, I should know the answer. They're gonna start to think I don't know what I'm doing. Ask the question. We're happy to answer it and help you reduce some of that anxiety that you might be feeling. So I'm gonna just open up and welcome again questions.
Yeah, so one question that came earlier, Laura Daniels asked about case books who have found especially helpful in clinical health psychology, or does their website offer recommendations on the reading for these materials? So I don't know if that question's been answered already. Any thoughts? Dr. Kearney, if you're on as well, you can jump into the discussion. I think there was some discussion about general CHP books. Lloyd, I think you submitted some of those. Do you want to talk about any of those you recommend?
I'd be happy to, with the caveat that these are my personal favorites. This is not necessarily an official endorsement. But if you're working in a primary care setting, I think a book that should be in everyone's bookcase is the Integrated Behavioral Health in Primary Care book by Dr. Goody, Dr. Hunter, Dr. Dobmeyer. Dr. Goody is our current American Board of Clinical Health Psychology president. This is just an outstanding resource. Talks about the fundamentals of assessment and treatment in the primary care setting. So I like that one. If the question is what's a good reference to review medical disease processes and conditions and clinical health psychology assessment and treatment considerations, a book that I reviewed, it just came out last year, is by Amy Wachholz, who's also another one of our oral examiners. It's called, Clinical Health Psychology, Integrating Medical Information for Improved Treatment Outcomes. What I really like about this book is it's organized by organ systems. And so if you want to learn more about renal disease processes and medications that can influence mental status, it's just a really well organized book. It's easily readable, it's authoritative. And it also talks about tailored clinical health psychology assessment and treatment considerations given these specific diseases. So that's another one of my favorites. But I would like to hear our other experts talk about theirs.
So this is a wild card. So this isn't a book. That's why it's a wild card. But if you have access to the National Register of Health Psychologists, there are phenomenal videos I watched like a ton of these videos before I did my oral exam that help give you a really nice review of some of the basics of different like diagnoses that are health related and some of the newer research and approaches to treating those. So depending on how, if reading after a while, you're like, okay, I get it. I've read a lot. Now I need somebody to say things to me. Having those videos, access to those was really, really helpful. So the National Register, and just to connect with Lloyd, Dr. Goody, so Jeffrey Goody, I think was 3 of the videos that I watched on that website. It was fantastic. So that's what I would add to that mix.
How about you, Mark?
I was just trying to think. One of the things was a Lang series book we used, which was a nice organization of different clinical health psychology topics that we used with our residents. And I thought that actually it serves also as a good kind of summary or basics for a lot of areas of clinical health psychology. If you, obviously your case sample is in an area of pain or things like that, make sure you've obviously read the books in that area, or if you've kind of doing bariatric work, you're familiar with that, psycho-oncology, just make sure you're aware of those, the main books in that topic area of which your case examples are focused on. Also, someone was asking Dr. Berg the title of the book you mentioned. Can you put it in the chat?
Dr. Vogel, this is Christina Shook. Sorry to be joining late. I was having major tech issues. There's also a question about advice for those pursuing board certification who work only with children and adolescents. And I can speak to that a little bit. I don't personally work with just children and adolescents, but I think that there are lots of psychologists that work with various specialty specific areas within clinical health psychology, and that's perfectly fine. You can talk about that as your area of expertise and the area within which you work, and as they ask you different questions about different disease states, or you give clinical examples, give those examples that are specific to your specialty area. That's perfectly appropriate, and you just want to make sure that you really talk about your expertise and how you manage those conditions within the realm of children. And if if they're asking questions about adults, you talk about how you might conceptualize that case as an adult versus as a child, and how you would seek consultation and mentorship in these areas.
Very helpful, thank you. Another question coming up about just kind of knowing where in the literature to focus. This individual is working specifically in a focus area like gastroenterology, and where do you kind of find yourself reading in general? And again, I think, many of us get very focused on our specialty area or subspecialty areas that we're focused on, like primary care or bariatric, things like that. I think that the division's own journal is a good one. It provides a good broad representation of topics. Journal, what's the journal from medical settings? Yeah, when you got the division one, I'm thinking the other one, I'm blanking on it right now. I have to look it up. But I think just thinking about what are kind of broad general journals, Journal of Behavioral Medicine is also a great one to kind of see what's happening broadly in the field.
Mark, were you thinking about clinical psychology in medical settings?
Yes, that one. Thank you.
Yeah, APEC journal.
Yeah.
Other areas of reading for general updates on health psychology topics. I am not getting paid by the National Register, but I will again say that the National Register for Health Service Psychologists, they put out a similar, a newsletter. I have it on my desk here somewhere. And they do a really nice job of covering a wide variety of health topics and approaches to clinical care for each of those. So that's another option.
I also had just a kind of a general statement. This is Christina Shook about all the questions about what books to read and what journals to read. And I just want to encourage all of you not to panic and think that you need to become disease state experts on every single medical condition under the sun. And, don't feel like you have to go do that and read every single book, but do, by all means, go read the literature and be up to date on things and conditions as they pertain to clinical health psych. Be able to apply a clinical health psychology biopsychosocial assessment and case conceptualization to any disease state. So read the things that are going to help you to talk about how you conceptualize cases, how you would treat these conditions, and be able to talk about that on the spot, on the fly, during the oral examination. They want to know how you think about cases. They want to know how you conduct yourself professionally and how you would manage a brand new case that comes to you that you might not have as much familiarity with. So talk about how you think about things, how you work on cases, and be able to talk about how you would use the literature to inform your practice. But by all means, don't think you have to be an expert on every single condition there is under the sun. Nobody is that.
Yeah, Christina, this is Lisa Kearney. I'm glad you're mentioning that because one of the things I do see people falter on when they're having oral exams is they're not able to speak to their own references in the practice sample. So if you're citing, I'm doing this intervention because of this particular piece of work, then I want to know that you're familiar with that work. And so as an examiner, I may be asking about that. So another thing is not just thinking about, I got to read all of these journals, but the areas in which I'm working and what I'm citing as the evidence base for the interventions or the assessment I'm doing, to really go back and review those articles again so you can speak thoughtfully about it.
Build on Dr. Kearney, that's consistent. So I do practice sample reviews. And one of the big pieces that's consistent through everything you submit throughout this process is that we want to see what's the evidence and what's your clinical reasoning. So you could have a case sample where you're like, here's the evidence, I pulled this out of what I did in my approach, but for this specific reason with this specific patient, I also did this, and this is why. This is what we really want to know, but we really want you to be able to speak to, for this type of patient, for this type of presentation, this is why I would choose this because this has the evidence behind it. And you have to write about in your practice sample your approach to care, your evidence-based approach, and the model that you use. And so being able to speak about that when you're at the oral examination, really critical, important. But again, you don't have to know all the topics to, again, reduce your anxiety. My samples, my cases that were handed to me, were two things I had never treated a patient for. I went, let's do that one. And I still passed, right? So I literally just said to my examiner, well, I've never treated either of these types of patients. This one seems a little closer to what I do on a daily basis. so we're just going to go with this. And they were very understanding, nice and kind throughout the whole thing. And I just explained my thought process. This is what I would want to know. This is who I would want to talk to. This is what I would think about. But I don't know if that patient would have been getting the most perfect treatment ever, because I would definitely need to consult a colleague about this case because I'd never treated one before. That's okay.
And it's not only okay, like Julia's saying, but it's important. That's the kinds of thinking that the examiner is looking for. If you weren't an expert in this particular area, what is the information you would need and where would you get it? So just the fact that you're going to say, I would be seeking consultation from my colleague, Dr. X, and implement their recommendations. That's an important piece of this process that the oral examiner is looking for.
So earlier on, when Dr. Berg was talking about the ethical section, a question came up really about elaborate on how clinical health psychologists in members of interdisciplinary teams might handle confidentiality in different ways. And I think one of the things that I think Dr. Berg was really trying to get at is when you think about what are the medical staff bylaws that you're working from and how do they similar or different from APA's ethical guidelines? And what if there was a conflict between the two? What if you heard two physicians talking about your case in the elevator? How might you respond? And so the more you're thinking about when the two worlds collide, their idea of confidentiality may be very different than yours. And so how do you integrate that? How do you manage those kind of conflicts when they come up? Those are the kind of questions you should be prepared to kind of discuss and kind of know in your own head how you are going to respond. I think, Dr. Kearney, you also said about shared medical records and kind of what people feel like they would look at or not look at in that kind of setting.
Mm-hmm.
Yeah. And the area of confidentiality, a clinical health psychologist thinks of that differently than, say, for example, someone who is a private practice clinical psychologist and does not engage with, on a daily basis with treatment teams. And so how do we navigate that gray area of confidentiality, or how do we make it less gray?
Right.
So that we're
again, the same Andrew also did a follow-up a little bit. If you think about very sensitive topics like abuse or things like that, how does that get documented in your medical record? You pick that up as part of your interview, but the examiner may ask you, help me understand how you would document that, how you would follow up. How would you share that with the treatment team? What would you not share with the treatment team, and why? What you're thinking about those kind of questions.
Yeah, Mark, as you're talking to, it's Lisa. One of the things I'm thinking about too is practice setting specific. So what I may be able to share in VA may be different than what you're able to do in a different setting. So knowing, like for me, when I was going through this process, what are all my VA policies and regulations? And then I work in the state of Texas. So what are the different legal issues in the state of Texas in particular, and being able to cite that clearly? Because, and if you're new to a state you're practicing in, you may get tripped up on that. So, wanting to go back and review those regs for site specific and physical location.
Right. And then I think we mentioned this earlier too. One of the things you can do with your practice sample or any of these sections is just work with a colleague to kind of have them ask you questions. Especially with your practice sample, you could share it with them and then say, what kind of questions would you ask if you were reviewing this case? So that you can kind of get yourself thinking about what questions might you likely expect.
Mark, I'm also just gonna, I don't know if we mentioned this earlier, but if you have not already accessed a mentor through the Academy of Clinical Health Psychology, if you were someone who's gone through the practice samples and did not have one, you can still get a mentor assigned to you that you can discuss these more fully, questions that you have about how to prepare, how to navigate the process, what are things that the oral examiners might be looking for. So this is an important service that the Academy provides for anyone who is going through the board certification process. And speaking personally, my mentor was invaluable, and there is one specific thing he shared with me that really saved me during one of these modules we're talking about. So please consider that.
So just re-emphasize that, Lloyd. So if you're already at the oral exam part, then you have passed your practice sample. You're good to go. However, some of you have reported that you're earlier on in the process. So asking for a mentor as you're putting together like your cases for your practice sample, but also say you have to revise and resubmit. That happens. That doesn't mean it's the end of the world, but you can ask for a mentor at any time. So say you did your practice sample initially and you thought it was like perfect, and then you need to try again, ask for a mentor. Utilize the support that's out there for you, because they're happy to help you, just to, again, to have those like critical pearls of wisdom of, oh, well, this might be a way to consider this. This might be a new approach to really help you succeed.
All right, well, we're really at the top of our hour. I appreciate everyone's participation. Hopefully you've gotten something out of this. We will have a recording of this available. We'll also share the slides that we had as part of this webinar. And then if we also have any other references or other answers to the questions, we'll try to provide that as well. So I thank you for your time and appreciate it.